Hi there, you're welcome to RX Care channel where we talk about medications and how to use them properly. If you're new to our channel, make sure you hit the like and subscribe button. That way you're able to get alerts anytime we post our informative videos such as this, and also in order to help support our community here at RX Care. So what medication are we going to be talking about today? So our medication for today is called zolpidem tartrate. So the brand name is known as Ambien or Intermezzo. And usually the medications, the zolpidem comes in about 5 milligram and 10 milligram. The controlled release form comes in a 6.25 milligram as well as a 12.5 milligram. And the sublingual form comes in a 1.75 and a 3.5 milligram. So what is Ambien used for? So Ambien is used for a short-term treatment of insomnia. However, I've seen patients take this for a longer period of time, which is not favorable because once your body get used to the Ambien, you might have troubles falling asleep or staying asleep when you don't use the medication. So usually patient will use it for about 4 weeks, and then they'll probably take it maybe like 2 to 3 nights in a week. That way your body doesn't get in a habit of taking that medication in order for you to fall asleep. So the medication is usually taken right before bedtime to kind of help you fall asleep faster and stay asleep for that period of time as well. So what are some of the side effects of Ambien? So some of the side effects of Ambien include headache, drowsiness, as well as nausea. So these are short-term side effects. So some long-term side effects of Ambien include dry mouth. It can cause back pain in some patient, allergy. It can also cause influenza-like symptoms, so like flu-like symptoms, palpitations. It can make the patient have this drugged feeling. I've heard some patients tell me they feel very woozy and kind of get that out-of-body experience when they take the Ambien. Usually, this would kind of reduce a time, and some patients might still say they continue to get it. So usually in this case, that's why you probably want to take it like 2 to 3 times a week. That way your body is not getting used to that feeling, and you're able to do well without the medication or sleep well without the medication. All right, so the medication can also cause joint pain as well as indigestion. So like I said, these are long-term side effects of the medication. It won't necessarily happen to everyone, but just in case if it does, these are some of the common long-term side effects that patients have reported while taking the medication. So what is a contraindication? So who should not be taking Ambien? So patients who have a hypersensitivity to Ambien should not be taking the medication. Also, this medication have been noted to cause sleep driving because the medication is like an hypnotic medication. Some patients have found themselves doing things while they're asleep and not having any idea of it when they wake up. So just in case if this is happening, make sure that you are reporting it to the doctor. That way they can kind of taper you off the medication and kind of get you to be taking the right medication to help treat the insomnia. Insomnia is a very hard condition. However, there are other medication and there are other techniques that you could be employing to help you sleep better. Such as taking like a lukewarm or cold shower at night, making sure that you're closing your blind, avoiding any triggers before bedtime, such as TV or like a bright light, making sure, like I said, that you're getting your body in tune right before you sleep, like reading a book. Those kind of tips can also help the patient sleep better. If you're having trouble sleeping, trying a melatonin medication can also help. I've seen patients take like a Benadryl as well for a short period of time to kind of help your body sleep better at night. Like I said, with usually sleeping conditions, you want to make sure you you're not taking medication consistently for it, because what your body is now going to do is it's going to get used to that medication, and you would not be able to sleep unless you take the medication. So making sure that you're employing some of those tips in your nighttime routine to kind of help you sleep better without the use of a medication. All right, so what are some other things that you need to know about this medication? You want to make sure that you're avoiding alcohol while taking this medication. Like I said, alcohol, the medication itself can cause drowsiness because it's meant to help you sleep. And taking alcohol can kind of increase that side effect, or increase that hypnotic effect that medication have. And also, like I said, the medication can be very habit forming. So patients may get addicted to the medication after using it for a long period of time. So make sure after about 4 weeks, you're discussing other options with your doctor in order to avoid these long-term side effects. Also, while you take this medication, you want to make sure that you're not going to operate any machinery that requires for you to be mentally alert. The medication can make you drowsy, so you don't want to do something that you need to be mentally alert for right after taking the medication. Also, for the controlled release form, make sure that you're not crushing, dividing, or chewing the tablets. That way it is not quickly exposed to your body and kind of wear off, after a short period of time. So make sure that you're swallowing the tablet as a whole with a cup of water to make sure that medication is being exposed or released slowly into your bloodstream to help you sleep and stay asleep for that period of time that you wanted to. All right, well, I hope this video was kind of informative for, and was able to give you insights regarding information regarding the medication. Make sure you hit the like and subscribe button. That way you can get more alerts whenever we post other educating videos. And also you can check out our website to talk to a pharmacist at www.damiarxcare.com. All right, thank you and stay blessed.